Hello, everyone. It's January the 25th, and Monday. We do have an additional 51 deaths. To be perfectly honest, that's a heck of a lot better than it's been. It's still terrible. We all know that, but it's surely better than it's been. And if we'll just step back and think about it, what I'm basing that on is now we've gone from Thursday to today. So we've really been 4 days. We've been Friday, Saturday, Sunday, and then today. And normally our briefings Monday, Wednesday, and Friday, we go 2 days. So this is a reflection of double the days of normal. And if we could get back to a briefing every other day and a number like 25 instead of 75 and 83 and 73 and all those atrocious numbers, it's better. I'll explain that to you in just a second. You know, I just went to Dennis Davis's funeral, and Dennis was our cabinet secretary for our Department of Veterans Assistance, and he just did an unbelievable job. And what a man, what a man, what a man. His smile was infectious. He's a big guy that always just lit up the rooms, and his family's really hurting, and you know, and I'm sure grandchildren, maybe even great grandchildren, you know, were there, and just it's just tough. I mean, it's just tough stuff. I mean, we lost a really, really great man. So please remember Dennis Davis and all of his family. I mean, what he did for our vets is just unbelievable. I mean, I go through all kinds of things, from helping to exempt their retirement, to getting them vehicles for assistance, to getting them additional offices and places they could go for assistance. It's just amazing what his commitment was to our vets, and what a great job that he did. And boy, what a wonderful friend. I can tell you from my standpoint, really miss him, really miss him. Today in the state of West Virginia, we now have 899 deaths, which is really terrible. We have 51 additional deaths today. Every one of these people are not statistics, they're names, and they have families just like Dennis Davis and loved ones. And so please keep them in your prayers. Our 849th death is a 64-year-old male from Barber County. Our 850th death is an 86-year-old female from Mercer County. Our 851st death is a 92-year-old male from Kanawha County. Our 852nd death is an 84-year-old female from Cabell County. Our 853rd death is a 74-year-old male from McDowell County. Our 854th death is a 97-year-old female from Hancock County. Our 855th death is an 84-year-old female from Pendleton County. Our 856th death is an 80-year-old male from Summers County. And I'm saying 800. And just bear with me. If I've done that, I'm going all the way back to the top, and I'm going to start all over. Our 1849th death is a 64-year-old male from Barber County. Our 1850th death is an 86-year-old female from Mercer County. Our 1851st death is a 92-year-old male from Kanawha County. Our 1852nd death is an 84-year-old female from Cabell County. Our 1853rd death is a 74-year-old male from McDowell County. Our 1854th death is a 97-year-old female from Hancock County. Our 1855th death is an 84-year-old female from Pendleton County. Our 1856th death is an 80-year-old male from Summers County. Our 1857th death is an 88-year-old male from Summers County. Our 1858th death is a 65-year-old female from Cabell County. Our 1859th death is an 87-year-old male from Hampshire County. Our 1860th death is an 83-year-old male from Wood County. Our 1861st death is an 84-year-old male from Wood County. Our 1,862nd death is a 69-year-old male from Pleasants County. Our 1,863rd death is a 64-year-old female from Wood County. Our 1,864th death is a 76-year-old male from Harrison County. Our 1,865th death is a 69-year-old female from Preston County. Our 1,866th death is a 65-year-old male from Nicholas County. Our 1,867th death is a 95-year-old male from Lewis County. Our 1,868th death is a 68-year-old male from Preston County. Our 1,869th death is a 62-year-old male from Wood County. Our 1,870th death is an 89-year-old female from Wood County. Our 1,871st death is an 81-year-old female from Wyoming County. Our 1,872nd death is a 70-year-old female from Logan County. Our 1,873rd death is a 54-year-old male from Burke. Our 1,877th death is a 96-year-old male from Wood County. Our 1,878th death is a 74-year-old male from Marshall County. Our 1,879th death is a 74-year-old male from Harrison County. Our 1,880th death is an 84-year-old male from Kanawha County. Our 1,881st death is a 79-year-old female from Wood County. Our 1,882nd death is an 89-year-old male from Harrison County. Our 1,883rd death is an 88-year-old female from Wood County. Our 1,884th death is a 71-year-old male from Mason County. Our 1,885th death is a 62-year-old female from Marion County. Our 1,886th death is an 88-year-old female from Wood County. Our 1,887th death is a 58-year-old male from Hancock County. Our 1,888th death is a 68-year-old male from McDowell County. Our 1,889th death is a 59-year-old female from Wood County. Our 1,890th death is a 76-year-old female from Wood County. Our 1,891st death is a 76-year-old male from Ohio County. Our 1,892nd death is an 83-year-old male from Wood County. Our 1,893rd death is a 64-year-old male from McDowell County. Our 1,894th death is a 75-year-old female from Hampshire County. Our 1,895th death is a 92-year-old female from Kanawha County. Our 1,896th death is a 78-year-old female from Fayette County. Our 1,897th death is a 68-year-old male from Jackson County. Our 1,898th death is a 94-year-old male from Fayette County. Our 1,899th death in West Virginia is a 56-year-old female from Cabell County. I apologize for messing up and everything because in starting out reading 800 and some when it's really 1,000 more than that. It's hard to believe, isn't it? Really and truly, it's just hard to believe. I keep going back to things like something that we would really, really, really notice. You know, the Sago mine disaster. When we had 12 miners, I think it was 12 miners that were trapped and 11 of them perished. Upper Big Branch, just think about the mine disasters that we've had along the way. Or think about an airplane crash or whatever it may be. Maybe it was a van or a bus and 6 perished or whatever it was. We've lost 1,899 people. Our numbers in lots of ways are better. We've only had 532 new positive cases in the last 24 hours, but we didn't test that many. Our cumulative continues to rise a little bit, but it's been not much. It's 5.57. Our active cases are down. They're 24,365. And the number of daily active cases in West Virginia has decreased. So that means the number of active sick people have decreased 13 out of the last 14 days. That's good. That's good. Our recovered cases are almost 90,000, 89,575. You know, Jordan, pull that graph up real quick and let's just look at that one more time. This is the top graph. The light colored is the, I think those are the recovered cases. That's 89,575. And the active cases, you can see, are dropping. The wider that gets, the better we are. Absolutely, that's what we want to have happen. The number of patients, like I said, in the hospital have dropped to 597. That's really good. We want nobody to be sick. The number in the ICU units are dropped to 151. Our RT rating is at 0.87. That's the fourth best in the nation. You know, all that's good stuff. I continue to remind everybody that's 65 and above, if you get the least bit of a feeling that's not normal, go to the doctor. I'm sorry, go get a test. Go get a COVID test immediately. Get a COVID test. And really and truly, if we find out that it's positive, we'll get you the antibodies and save your life. That's all there is to it. You know, we hit another unbelievable milestone in West Virginia. We continue to lead the nation in every way. You see it on the national news. I mean, for crying out loud, right here is the cover of the New York Times. The New York Times. And right here at the very top, it said, West Virginia speeds ahead on inoculation. The cover of the New York Times. Everybody knows it. Everybody knows just how great West Virginia is doing, and all I can say is pour it on, West Virginia. Keep doing it. You know, imagine this. On our first doses, the first doses that we've received, we have now this is a hard number to believe, but what if I told you on first doses, we have them in arms of 106%, 106.4% that are in somebody's arm. And you're going to say, well, how in the world can you exceed 100% of what you got? We're getting more doses out of the vials than what they really anticipated. But 106%, 106.4% of what we've received are in somebody's arm in West Virginia. That's really great stuff. And so I congratulate all the healthcare workers and the Guard and the DHHR and everybody that's had to listen to me scream and jump up and down and do everything in the world, but really and truly it's working. And I thank you so much for all the great work you've done. We've put out in first doses 166,358 doses to our people, 40,258 second doses, which means that we have sent out and we have put in arms 206,616 of our great people in West Virginia, and we're saving lives in doing so. You know, all of our counties and our community partners have played important roles in this as far as getting the West Virginia vaccines out, and I thank them again and again. And we continue to lead the nation, and that's what I want us to continue to do, because every time we're leading the nation, we're saving somebody's life, and that's really good. Now, in addition to that, we got another first in the nation. This morning, we became the first state in the nation to launch a COVID vaccine pre-registration system. All West Virginians can now pre-register to get their vaccine. And as we get the vaccine supply from the federal government, we will absolutely quickly and efficiently get those shots in arms. You can pre-register online, or you can call our COVID vaccine info line and get help in pre-registering. It's important to remember now, this is just a pre-registration. That's all it is. It's just some way to make it more convenient where you're not calling on the phone, because I hate that like crazy. you're calling over and over 100 or 150 times and can't get through. Now let me back up and let me just say just this. And I say this directly to all of our seniors, all of the people that are out there that are trying some way, somehow to get vaccinated and everything, but just think about this. This is anything but tooting our horn, but I want you to understand something very clearly. I know of the inconvenience, and I hate it, and that's why we've done this. This cost $700,000 to the state of West Virginia to do this, to make it more simple and more convenient, because we don't want people, on the phone forever and a day. We don't want that, because that would be terribly frustrating to me. I know it's terribly frustrating to others, but here's the but part of the whole thing. And it's just this. If West Virginia had not pivoted and not gone this way, I mean, really and truly, at the end of the day, all of our seniors and everything, many had lost hope. Had lost hope because they knew they couldn't get a vaccine shot, really and truly, until probably April. Well, it's January. It's January. And I'm going to read a number to you here in just a second that is absolutely just wonderful. Well, I'm going to jump over to it if I can find it real quick here and everything. But, well, I'm just going to, y'all just bear with me just 1 second. And get this number. So far, in West Virginia, there has been 73,751 individuals in the 65 and older population that we've vaccinated. Now, we were told and we were given models by the federal government that really basically said, we can't get to you probably until April. But we didn't follow that model. We've got in the arms of West Virginia individuals 73,751 shots as of today. Now, it doesn't count second shots. That's first round shots in somebody's arm today. Today. How many people have we saved their life? How many? 1,000? 10,000? 20,000? Whatever it may be. It's great work by a lot of people that have really put in a lot of licks and everything. And that's really good stuff. Now, let me go back to how you can pre-register for your shot. And as we get the vaccines in, we'll get them available to you immediately and everything. And we just this morning launched this, and we've already had 32,723 West Virginians pre-register as of just a little bit ago. The system is running smoothly, and we haven't seen any issues so far. We probably will, but it's a whole lot better than telling you, well, we can't get to you till April. You know, if we have some bumps in the road, it's a heck of a lot better than April. For those that don't want to go online, you can still call, and staff will put your information into the system. Once again, we're doing an outstanding job in leading the nation in our approach to get this vaccine rollout. I'm excited to get this system in place, and I truly hope it will be a big benefit to West Virginians, so you're not sitting there dialing, which is ridiculous, and I hate like crazy that you've had to do that, so that we can continue to lead the nation in getting our vaccines in people's arms. In saving our wisdom, the community vaccination clinics, boy, have they been wonderful. As part of Operation Save Our Wisdom, are open to West Virginians 65 and older. We do not have enough doses to vaccinate all West Virginians right now, but as soon as we continue to receive doses from the federal government, we will get them out and get them in people's arms. This week, multiple Vaccination clinics will be held in 17 counties across the state. And those counties this week are Berkeley, Braxton, Brooke, Cabell, Greenbrier, Hancock, Harrison, Hardy, Kanawha, Logan, Marshall, Mercer, Monongahela, Pocahontas, Raleigh, and Randolph and Wyoming counties. Next week, there will be vaccine clinics in all 55 counties. They will receive a number of vaccine doses based on population. This will make sure that our limited supply of COVID vaccines are reaching every corner of our state. Now look, there was an article in the Beckley paper, and I was reading it and everything, and there was a lady that was really complaining, I think, about McDowell County or one of the counties in southern West Virginia and everything. Again, our people are really trying really hard. Now, we don't need any kudos in any way. We don't even need any thanks, but I can tell you these people that are out there putting everything on the line to make it happen absolutely deserve your respect and appreciation. Now, with all that, they're trying to make it easier, and we're trying to get to every single county in the state, but at the same time, we are trying with all in us, with the resources that we have, to get shots in people's arms. Like I said, we've got 73,751 in people's arms that are 65 and older, and we're going to be in every county in this state next week. Now, next week surely is not maybe fast enough for everybody, but next week is one hell of a lot better than April. And so we're really after it, and we're going to stay after it. As far as our long-term care facilities, there have been 15,282, of our residents and 16,965 of our staff and in our long-term care facilities that have been vaccinated. That's really good. The COVID hotline or vaccine line is up. You've got that there. Vaccine reminders, you absolutely the very best defense that you have. And it's everywhere. It's everybody just says the same thing. Wear your mask. Wear your mask. That's the best defense that you have. And as we go forward and everything, we'll get you your doses and get you the vaccines, and that'll be great too. If you have a symptom whatsoever, go get tested. Quickly get tested, and demand of your doctors and everything that if you do test positive, that you get these antibodies, especially if you're 65 and older. Take advantage of our free testing opportunities. Continue to do that. They're all over the state where you can get tested and everything, and the map's on the hotline there or our website rather. And again, thanks to all the drive-through pharmacy work that Walgreens and Fruth has done, and we really appreciate that. We're down to 86 outbreaks now in our long-term care facilities. Our churches only have 6, and that's in 5 counties, and that's great work from our church community and everything. Great work. And that's in Clay, Hampshire, Nicholas, Summers, and Wetzel counties. Please keep it up. Wear your mask. Get that pew in between you and everything. And if you're older, maybe just hold up on going to church. Just if you can get your services online, just hold up just for a little while. And absolutely, we're going to lick this thing. We've got 261 inmate and 30 staff, cases that are in our corrections now. With 207 of them are at Lakin, and 49 of them are at North Central. Good work again by a lot of people, and I'm sure they're running to the fires here too. I've said this over and over: wear your face mask, get your flu vaccine shot. Absolutely, if you can, if you've had COVID and you've recovered, and that number was 89,575. Surely to goodness, you've got to realize the level of the blessing that you have got bestowed upon you by God above, that you have recovered. Now think really hard. If you can see your way fit with the guidance of your doctor, go give blood. We really need that. Again, the only other thing I'd like to pull up is the school map, you know, and if y'all could pull that up real quick. And you just look, other than really one county, for the most part, a lot of border counties, and I know up in the northwest side of the state, you know, we've got counties that aren't necessarily border counties, but other than that, really and truly, our map's getting better. It's just getting better and better, and we just got to keep at it. Only other thing, remember all these people in your prayers, and Dennis Davis too. Thank you so much.
All right, thank you, Governor. Our pandemic leadership panel is joining us today, and they are all available for questions, but we'll go right now to questions from members of the media. The first today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if someone could give us a little bit more detail on the 106% thing. Is that due to the manufacturers are actually putting more in the vial than is listed? Is that consistent? Is that every vial we're receiving, we're able to get these extra doses on? And is it consistent enough for us to be able to count on that? If we're getting, you know, our 25,000, you know, a week, do we know how much extra is in there? Thank you.
General Hoyer, you can go, but if it remains consistent, you know, Charles, at 25,000, it's not insignificant. At 25,000, you pick up that extra 6%, you're picking up a little more than 1,500 additional doses we can put in orange. But General, go, please.
So, Charles, we are getting doses from both Moderna and the Pfizer, primarily from Pfizer. I think it's a combination of a couple of things. We added the 6th syringe into our ancillary kit packs to make sure, because we saw early on that there were extra doses coming. There was a lot of best practices data shared across the 55 counties. We've had some great work from the pharmacy board to help with training. It is not every single vial that you get the extra dose, but we are getting enough. As the governor pointed out, this is making a significant impact. And we now plan for that and take the analytics into effect to make sure we're getting maximum number of doses to our citizens. Thank you.
All right, thanks, Charles. Next to Kenny Bass with WCHS and Fox 11.
Is there any thought to, once you get this thing rolling for a couple of days, you go back and look at some of the procedures? One person who contacted us, this may affect more than just him, but we've only heard from one thus far, is he was only able to register himself. He could not register any other members of his household who are eligible to be pre-registered for the vaccine. So once you get rolling for a couple of days, is there a chance people can make more than one registration to save them from trying to call in and attempt to call in again? Thank you.
Secretary Crouch, that's you, sir. And congratulations on getting that up. We really appreciate
it. Secretary, you're still muted.
Sorry about that. Thank you, Governor, for that. Our folks have done a wonderful job. It's to roll this out in a week has been quite an experience, but we're pleased that it's going well. We just passed 40,000 individuals. So while the governor was talking, folks have continued to call in. There is a glitch right now, I'll mention, with regard to the telephone lines. It is not DHHR, not the call system, but some people are apparently getting recordings and saying that the line is out and won't be available again until February 1st, or in some cases, February 5th. We've got Verizon working on that, so we hope that will be fixed very quickly. Kenny, your question is a great one. We actually talked about that yesterday, and we were going to try to register folks in the same household. We did have experiences where individuals would call in, have called in, and have long lists of people to register. So we're looking at that and seeing how we can speed that up. But Kenny, you're right. We should be registering people in the same household, and we will fix that immediately. So thank you for that question.
All right, thank you, Kenny. Next is Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers. You brought up Lakin, and I wanted to circle back to this question. In light of both the number of cases in the correctional system and I believe a figure that was spit out a couple weeks ago in regards to how many correctional officers and staff are actually opting into the vaccine. Has there been any other talk about trying to get inmates, or at least inmates within the high risk categories, age 65 and up, vaccinated to provide some additional protections to those inmates? Thank you.
General Hoyer, I think that's you again, sir, or Dr. Marsh, one of the two of you.
Yes, Governor. Stephen, we continue to look at the data. We do know now that more correctional officers have come back and asked to take the vaccine. We also have been working with corrections on data related to their most vulnerable population. Again, it goes back to availability of vaccines and knowing what we've got to go after immediately with our older population. Thank you.
All right, thank you, Stephen. Next to Mark Curtis with the Next Star Media.
Sorry about that. I'm not the most tech-savvy guy these days. Governor, you read some awfully good numbers there, awfully promising numbers. I believe cases down 13 of the last 14 days. While that's the good news, are you and the doctors in the room concerned that people are going to start letting their guards down again and having bigger gatherings and doing all the things that you've advised them not to do over the holidays, simply because the numbers have gotten better? And I think that lulls people into a false set of security.
Well, Mark, all I can do is just say this. I don't try to sugarcoat things when things are bad, but I sure want to tell people good news when things are good. I think it rejuvenates us and gives us hope when things are good, and I hope to God above that they have the good sense to know that we're not out of this yet. And this spin cycle was pretty dadgum tough. And we've been there and been there and been there, but until we get probably 80% of our population vaccinated and maybe a little bit of time under our belt, with our nation and it being vaccinated and everything, we're probably not going to get there until we get to a situation to where we've got that herd immunity that everybody speaks of. But Dr. Amjad, join in on this and everything, and I think it's a great service of what Mark has given us, because basically, he's given us an additional platform to say, and he's saying the same thing. He's concerned that maybe as things get better, we drop our guard. And in West Virginia, you can't drop your guard. So thank you a bunch, Mark. But Dr. Amjad, please join in.
Sure, Mark. That's a great question. And as the governor said, we do want to highlight that West Virginia has been doing a great job, and we commend them for that, for wearing their masks and being socially distanced. But we do want to remind everyone that you still need to continue doing what you've been doing great. So we applaud West Virginians for doing so well. We do like the numbers that we see. We are surprised that they are low, but as the governor mentioned, we can't let our guard down right now. We are at a point right now that things can possibly get worse, but I myself am not a pessimist all the time. We like to be hopeful. We like to keep going forward. But West Virginians, we still need to wear our masks, even after you've been vaccinated. With the new strains coming out there, you have to be vigilant, wear your masks, stay in your family units. So that is something. But we like to remain hopeful. We like to remain positive, but we still can't let our guard down. Thanks.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, you've gotten a lot of good publicity, great publicity on the #1 ranking nationally in the vaccine rollout. I'm wondering if any of that has spilled over into economic development. If somebody has seen that publicity and picked up the phone and called the Economic Development Office in West Virginia and said, hey, that's where we want to be.
Listen, I don't know. I have not really, followed back up and checked and everything, but Paul, of course it's happening. For crying out loud, just think how many patients getting them all the second shot. First in the nation with assisted living. First in the nation in, personal income growth in certain quarters, or first in the nation in construction jobs and everything. Well, and now first in the nation in rolling out the vaccine, and maybe first in the nation in having a system to be able to pre-register people. Every single bit of that, every single bit of it, Paul, does one thing, and that is it tells the outside world that West Virginia is not that backward state. West Virginia is a state that they missed, the diamond that they missed. And you can bet your boots, brother, that is absolutely driving more and more and more people to give West Virginia a good look. And so absolutely, that's exactly what I've been talking about over and over, because at the end of the day, it will really help us all.
All right, thank you, Paul. Next to Kimberly Keggy with WSAZ.
Hi, everyone. Hi, panel. Good morning. We've seen a fairly smooth process this far on the pre-registration website for the COVID-19 vaccine, but I've had a lot of viewers reach out to me saying once people are starting to begin to be registered, how is the state planning to use information to put together wait lists? Will it depend on the age category, or for some of those with underlying health issues, will they be put above maybe someone who is younger than them? Thank you.
Secretary Crouch, this is you again, sir.
Yes, sir, Governor. Thank you. Yes, good question, Kimberly. As we've talked about over and over, age is the primary issue, the main priority right now for vaccinations. We are saving lives by getting our elderly vaccinated. Governor made the elderly a priority back in April of last year, almost a year ago, and I can't imagine where we would have been if he hadn't done that. We got our elderly tested first. We've gotten them vaccinated first, and we're trying to protect those 65 and over at this point. So that's the priority, but we're also prioritizing teachers age 50 and over. We've prioritized our healthcare workers, those on the front line in hospitals, and our workers out there, our EMS workers and first responders. So those are the individuals we're prioritizing first. As we move down the list, we'll provide more information going forward. I want to remind everyone that the system is working well, but please use the website if at all possible, rather than the call-in. The call-in, we're having a little bump in the road as I talked about earlier, but we're pleased with the way things are going right now. So we'll push more information regarding priority out in the next couple of weeks. So thank you for the question.
All right, thank you, Kimberly. Next to Aaron Williams with WBOY.
Governor, this question comes from our sports reporter. Back in October, the West Virginia SSAC put out COVID modifications for winter sports, things like eliminating jump balls, post-game handshakes. Now that all the counties are back to in-person learning in some form and winter sports practices are set to start in a few weeks, have you or your office been a part of conversations about how these sports will actually happen in terms of additional modifications, or if or how fans will be involved? Thank you.
Let me answer it real quick. You know, from my standpoint, we're always working, everybody's working with the SSAC. We think they've done a marvelous job. You know, Bernie and everybody there is doing, Greg and everybody's doing great work and all that. And we just want, you know, and Wayne, all of them are doing fabulous work. But as far as not having jump balls or something like that, I don't know. You know, I really don't know, but it seems that doesn't seem practical to me. I mean, if kids are running up and down the floor and they're banging into each other everywhere, but nevertheless, we'll be rolling that out more and more. It looks like, you know, we're completely on a go for February the 14th, beginning practice, and I love it because, gosh knows, I just think it'd be great to get our kids back to playing. So, nevertheless, we're watching everything, but right now we're on a complete go for February 14th.
All right, thanks, Aaron. Next to June Leffler with West Virginia Public Broadcasting.
Hello. So I want to go back to corrections, and like you mentioned, Lakin has, you know, more than half of its inmates in there that currently have coronavirus. So I am wondering, Dr. Amjan mentioned introducing a newer antibody treatment to correctional facilities a while ago. I'm wondering if they have that treatment and if that's being implemented in correctional facilities right now. And really anything else you can tell me about what the DCR is doing to address these outbreaks like the one in Lakin.
Okay, I want to be sure we get Dr. Marsh on here and everything. Dr. Marsh, do you have anything to add, or do you want to go to Dr. Amjad?
I think I'll defer this to Dr. Amjad, Governor, if that's okay.
No, that's fine, sir.
Sure. June, we have introduced the antibody, the monoclonal antibody in some of the correctional facilities. One of them, Tiger Valley, did use it, I think, about over a week ago in one of their facilities right there. So they are using that. West Virginia actually is one of the first states besides Alaska that is using it right now. So we are using that for any inmate that does qualify to use a monoclonal antibody. So we are doing everything we can for the inmates that do suffer from COVID-19. And as we mentioned before, if an inmate is really sick, they do get transferred out of the facility. But we did have a call with the medical providers of the correctional facilities to keep them up to date, just as we would with the long-term care facilities and any other provider in the state, keep them up to date with any of the, treatment options that are available to anyone in the state as well. Thanks.
All right, thank you, June. Last question today from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Can we get an update on efforts to increase the amount of vaccine we're getting from the federal government? Obviously, no matter how efficient our distribution system, if we're getting 25,000 or fewer doses a week, it's going to take a long time to distribute 3 million vaccinations.
Well, Phil, let me touch real quickly. Let me tell you this, that I'm in contact with them nonstop. I'm screaming my head off. I continue to tout how West Virginia's doing and how much we want to be supportive in everything we do. We absolutely do, but we haven't heard from Clay. Maybe, Dr. Marsh, if you could add a little bit to this, and maybe General Hoyer, but I can promise you we are really, you talk about stink on what, this is absolutely stink on what from the standpoint of how hard everybody's on this.
Sure, Governor. I'm happy to make a couple of comments, and thank you, Phil, for the question. We believe that without changing any of the current infrastructure that we have created with our partners, that we could distribute 125,000 doses of vaccine per week, which would greatly accelerate our ability to reach our prioritized groups. We have had contact, as the governor has had constant contact. We've also had contact with folks in the administration at the White House and through the CDC and other pathways where we have certainly made our case. And as the governor said today, the fact that we have distributed over 106% of the vaccine that we have been given on the first dose demonstrates, I think with no uncertainty, our ability to efficiently utilize all the vaccine that we're given. So we are asking with everything in us to get the amount of vaccine that we want to be able to immunize our citizens with, our vulnerable citizens, our critical workforce and hospital group. But, as we have seen in other states as well, right now, there is a production issue. And we very much hope that production issue gets solved very quickly. And with other vaccines that are coming on the forefront, perhaps the AstraZeneca vaccine and the Johnson & Johnson vaccines, which we anticipate will come up for emergency use authorization at some point, that should also give us more capability to have access to more vaccines. General?
Clay, I think you've covered it well. The governor continues to press us also to demonstrate to FEMA and others the network capacity that we've built to show that we can take more vaccines. He presses us every day to press them, as well as him staying on top of this constantly. And that's our big push right now, to get more vaccines.
All right, thank you, Phil. Governor, back to you to close out.
Okay, well, I'd close out real quickly by just saying this, 106.4 of anything. I don't care what you got. If you're doing 106.4 of what you got, you're doing pretty dadgum good. You know, if you're doing 106.4% of what you got. And meaning we're getting more out of the squeal out of the pig than you can imagine. And that's really good stuff. And we're doing it and not wasting anything either. You know, you don't have a situation in West Virginia where you've seen that we've had, 8,000 vaccines that just went bad or we threw away or whatever. You don't see that in West Virginia. And again, that's because of these great people and all the unbelievable work that they're doing. I want to just say this, I'll be reaching out to the coronavirus czar again at the White House today. I'm going to continue to, I hate to say it, I don't want to become a pain or a pest and bug him to death, but I got to. I got to because we just need more vaccines in West Virginia. But I can, I'll end by just saying this, as we keep going, there is going to be a day. There's going to be a day, and it's not terribly far off, we hope and pray, where we won't have the deaths, and we won't have the pain, and we won't have to wear these terrible, nasty masks. But I got to go, and we got to go fairly quickly today because we're about to announce something in north central West Virginia. We have an announcement, and it's supposed to be at noon today. And I've been asked to speak at the announcement that the Mon County Health Department and WVU Medicine and Monongahela Health are making an incredible announcement today at noon. And I guess we'll be playing it on our website here or whatever. But I apologize for rushing off, but we got another great announcement that's going to help a whole bunch of our people and everything, and we want to just keep pouring it on. So thank you so much for being here today, and we're going to keep at it. Keep doing good stuff, West Virginia, please.